Here with me now, we have two Colorado lawmakers, Representative Dylan Roberts and Senator Carrie Donovan. And we also have Dr. Camilla Sasson, 9 News medical expert. Both of you worked on legislation last session that would have essentially forced transparency when it comes to the high cost of insulin. Talk about where that legislation ended up and what you're planning on doing for the next session.
Yeah, so we had a bill last year that would have shed some light on the insulin industry. Insulin prices have increased hundreds of percentage points over the last few years in prices, and our bill would have given people with type 1 diabetes and their families answers as to why. So it would have shown how much it actually costs to produce a vial of insulin, how much the companies are making from a profit of it, how much profit they're making on it, and then all the middlemen who are involved in actually getting that insulin to patients, because the price is becoming so high that people can't afford insulin to stay alive.
Yeah, and we're hearing stories from viewers who share their struggles with paying for insulin right now these days. Why is that cost so high?
Yeah, and we actually don't know a lot of the cost drivers, and that was the intent of this bill. You know, because we do see these incredibly large price increases that don't reflect market influences or perhaps what we're seeing with other drugs. And so we really ran this bill to say, hey, let's kind of shine some sunshine in on this process. And it was just, this bill just said, just report your numbers to the state. And then the state will put them online so that people have an opportunity to kind of look at these numbers and understand it a little bit more. But unfortunately, we weren't able to gain support even for a simple transparency message like this.
Yeah, I mean, this is a health issue that doesn't discriminate. I mean, regardless of the politics that you hold. I mean, this affects everybody. I believe there's more than 1 million people in our country that suffer, that live with diabetes, and your bill just did not move forward. What happened with that?
Yeah, it passed the House with unanimous, with bipartisan support. So it passed the House with bipartisan support, then came over to the Senate, and we were unable to gain support from the Republican Party, and so it died early in committee and didn't even get to the floor of the Senate for full debate, which was really disippointing.
And I'm assuming you guys are going to try again this next session.
Yes, yeah, we're looking forward to bringing this issue to the forefront again. People living with diabetes deserve answers. People deserve answers on the price increases on a lot of prescription drugs. Diabetes is just a really acute problem because people need insulin to survive every day, so they have to purchase this product no matter what it costs. And I think people deserve answers, so it's a cause that we are looking forward to bringing again.
And this is your second term.
Yes.
You came into the legislature kind of with a drive to kind of do this for your brother. If you could share your personal story about why you're doing this.
Yeah, my brother, little brother Murphy, was diagnosed with type 1 diabetes when he was 11 years old. All of myself, my siblings, we were all living at home at the time, and it became a family disease, something that you live with as a family, making sure that Murphy was on track and healthy and monitoring his blood sugar. And so I knew about the daily struggles of somebody with type 1 diabetes. Before I was elected, Murphy passed away because he had a diabetic seizure and fell and hit his head and passed away from complications from that. So I didn't run for office knowing that this was the only thing I wanted to do, but when I did get to the legislature, I wanted to shine a light on a problem that I knew a lot about, and I knew that thousands of other Coloradan families were dealing with.
From your constituents, what are some of the stories you hear from people who are struggling to pay for their insulin equipment and their treatment?
You know, they are heartbreaking stories because having access to insulin is access to life. And so you see people having to really balance these decisions of how do you cut back on something that keeps you alive. That's an impossible decision. And if they do cut back on it and start to make these tough decisions to make the bill payments at the end of the month, it has really significant health consequences. So, for example, college accounts start to become threatened. You wonder how you're going to pay your mortgage. And it's also because these increases have happened so quickly and so significantly that people haven't been able to budget or plan for them.
Yeah, I mean, you go on GoFundMe, you can see thousands of people essentially looking for help to pay for their equipment. You worked in the ER for a long time. You've been in the ER for a long time. I'm sure you see stories all the time of people coming into the hospital because they can't afford their insulin equipment.
I think it's just so funny. Being sick is nobody's choice. Nobody chooses to be sick, and I can't say that enough. Nobody wants to have diabetes. Nobody wants to have hypertension. Your brother was a type 1 diabetic, which means that his pancreas literally could not make insulin. So there was no other option other than that. And I think that's something that people need to recognize, is that no one wants to be sick. Nobody wants to be unable to afford their medications. And I think that's where you start to see the consequences when people start coming to the emergency department instead of seeing their doctor, for example. So, new study that came out last week that showed 1 out of 4 patients who has diabetes skimps on their medicine, doesn't take it. And that tells you something, right? It tells you that we're in a crisis kind of situation, and we have to figure out how to make it affordable, make sure that people are talking about it, and make sure that people understand why it's so very important, because you can end up in the ER in a coma. You can end up on dialysis, you can lose your sight, you can lose your limbs. There's so many consequences to diabetes, and it's so very important for folks to get treated with insulin, which is truly a life-saving medication.
And I know you two have been focused on transparency, and I don't know if you could speak to this, but what can be done maybe on a local legislative side to bring that cost down?
So I think transparency is absolutely the first step. We don't have the answers as to why these prices are going up so rapidly, and transparency is the first step that we need to have so that we know where the problem point is, who is responsible for these price increases, and then we can take the measures at trying to figure out how do we bring down prices. But without transparency, these companies and these pharmacy benefit managers and the entire supply chain is shielded from public view and can continue to raise prices without any accountability.
Any other thoughts?
I think, too, we've seen success in the past with public pressure on these large pharmaceutical gigantic corporations that kind of forget the human side of what their bottom line means. And so if we can kind of expose the full chain of where the money is being spent, it's a lot easier to provide directed public pressure and hopefully give an opportunity for a large conversation to get these corporations to start doing the right thing for people.
Yeah, because we're hearing stories of viewers who have, essentially, if they're not insured, they have to spend hundreds of dollars per month to cover their treatment, right?
At least.
Yes.
My mom, who is on Medicare, mind you, so she has some type of insurance, pays over $800 a month in medications alone. And that's her co-pays. So she's got some type of insurance. So think about that. Somebody who's got diabetes, who maybe then also has high blood pressure, has other things too. You're literally spending thousands of dollars. And I think, the price transparency thing is so important because doctors really have no idea. I try to prescribe what I think is going to make you happy, healthy, and you're going to stick to it, right? Because that's probably the hardest thing, is to get patients to stick to their medication treatment. And we don't really talk a lot about cost. And I think that's where something like this could be really helpful, to help include doctors in that conversation as well, so that we can sit down and really say, let's figure out what's the right plan for you and how do we make sure you can afford it.
All right, we're almost at 10 minutes here. Any final thoughts you'd like to add here about this?
I would just say we know that it doesn't have to be this way. Insulin was intended to be an inexpensive drug. It was developed back in the 1920s. The modern form of insulin has been around since the 90s, when it cost $20 a vial. Now it can cost $300 a vial for that exact same insulin. The quality of the product hasn't changed at all. That's an 800% increase with inflation over just 25 years. People don't choose to get diabetes. Type 1 diabetes is a disease that afflicts children primarily. They get diagnosed when they're kids at no fault of their own. It's not because of too much sugar. It's not because of diet. It just happens, and they have to live with it for the rest of their lives, and they cannot survive without insulin.
Yeah, great.
And I think another thing that Representative Roberts and I are really hopeful for is that this bill can provide a model of how we can address other increasing prices for drugs across the spectrum, because insulin is one that we feel very passionate about, but sadly it's not a unique story in healthcare right now.
How are you going to try to convince your colleagues at the Capitol that this needs to happen, that this transparency needs to happen this time around, because your bill failed last time?
A lot of bills take education, and so you do end up introducing them multiple times to let people learn the stories, learn the problem. The number of complex issues we tackle at the Capitol every year is immense, and so some issues like this do take multiple years to learn. So I'm really hopeful that my colleagues in the Senate can see the humanity behind this bill and the need for it, and that we'll get strong bipartisan support. Luckily, this year, we do have enough votes in both chambers, I believe, to get some legislation like this passed, because we have made some changes in the Capitol. But this shouldn't be a partisan issue.
Well, this really affects the middle class. I mean, I think we have to really recognize that. It's not the folks that have insurance who maybe make over $100,000. It's really the people that are kind of living day to day, trying to just make it and trying to get by. And I think that's something that's really important to think about, is that this is everyone's issue. Yeah. It's, again, not above or below or wherever it is. It's everybody.
Yeah.
Good discussion. Yeah. I think we're wrapped up here. Thank you so much for coming in.
Thank you.